If the scene is safe, approach the victim and assess their responsiveness. Send the other person to activate the emergency response system and get an AED. Assess breathing and check the carotid pulse. If the victim is not breathing or only gasping and has no pulse, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For adults, this is at least 2 inches. Open the airway and deliver 2 breaths, each lasting 1 second, and watch for chest rise. Resume compressions. When the AED is brought to scene, the second rescuer should begin by turning the device on, remove any clothing from the victim, and apply the AED pads, one below the right collarbone and the other to the side of the left nipple below the armpit, while the other rescuer continues performing CPR. Plug in the connector and clear the victim while the AED analyzes the rhythm. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR beginning with 30 chest compressions. After the compressions, the second rescuer opens the airway and delivers 2 breaths. Continue CPR at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives. The rescuer should switch roles every 2 minutes or after 5 cycles of CPR.